Hello and welcome to this week's episode of the Male Fertility Podcast. This week we're going to be covering something that I am very passionate about, testosterone. And that's because I use TRT, for which I'm sure we'll come on to later. But without further ado, let's introduce our guest. We're delighted to be joined by Dr. Jonathan Andrews, who's the Medical Director at TEDS Health. Welcome, Jonathan.
Oh, thank you very much for the warm intro, Shaun, and pleasure to be here.
Oh, it's a pleasure's all ours. Thank you. Thanks for joining us from your holiday. I think that's definitely worth a mention on the recording. We are very grateful.
Anytime.
Brilliant. So yeah, Jonathan, if you could perhaps just give us a bit of a background about who you are, what you do, and what happens over at TEDS Health.
My background, so I go by Johnny Andrews. Jonathan's what I'm registered with the Doctors Council, the GMC. So that's often where people get that from. But essentially, I am the medical director at a company called TEDS Health. TEDS Health has been around for close to 3 years now. We are one of the earlier digital TRT providers in the UK. There are now quite a few. And we are, at least for the first few years, exclusively focused on TRT, testosterone deficiency, all the way up from diagnosing to treating proven testosterone deficiency with TRT. And there are a range of medicalized options. We use licensed medication, and we are regulated by the CQC, the Care Quality Commission, which is the health and social care regulator in England. My background is a doctor by trade. I've been practicing for over 10 years now. But prior to that, I had a life in medical sciences where I was quite interested in research. I studied the biology of aging and, neurobiology, but actually ended up on a project focused on metabolic pathways and endocrinology, which essentially is that specialty in the science where testosterone, hormones, and hormone health fit in. So that was, if you like, an initial segue into the interests of where I've come to now. So after that degree, I then spent a bit of time in the corporate sector. I worked in sales, which might seem a long way away from what I really do now. But in many ways, that opened my eyes and my ears to the commercial world and eventually startups. During medical school, like many people, I was doing a range of different jobs, various kind of gig works, also tried my hand at entrepreneurship and many failed ventures of my own, bootstrapped, and not really healthcare to begin with. But after qualifying, I can't remember the first thing I ended up doing, but I started getting a bit of a bug for technology companies and startups. And I think it was because, as many people saw in the latter 2000s, 2010 plus, there was a kind of wild foray of apps, and internet startups were becoming ubiquitous, and it was becoming easier and easier to order things from your phone, order things and do things from your phone. But healthcare as we knew it, especially in England as well, which, while yes, we do have an amazing NHS, seemed to be so backwards in many respects, very analog. Simply trying to get to speak to a healthcare professional, whether that's a doctor, a nurse, or whoever, can and still is in many cases quite a long-winded process. And I still work in the NHS now, and I'm very proud to do that. And I do value the in-person connection time with patients, which I see in urgent care, which is a little bit of a segue between kind of your GP and A&E. And that exposes me to any kind of illness that people come in with, or an injury. And I really do love that aspect of healthcare, but unfortunately that's very reactive healthcare, meaning we're treating a problem that has in some cases been there for a long time. And again, as many people know, partly due to issues with healthcare systems globally, as in lack of supply and rising demand with aging populations and illness, and some of it is hangover from COVID. We are seeing people in hospitals and also in primary care and GP who have had problems for years. They'll come in. It's almost a little bit of a joke amongst the medical professionals that people come in and say, I've come in with chest pain. How long has it been going on for? I've had it for a year. Why have you come in today? Is it any worse today or in the last few days? No, that's the only time I managed to actually get to see someone. I finally got to the point where I decided to come in and do something about it, and I finally managed to get an appointment or turn up somewhere. So that's a very reactive way that people are seeking out trying to fix something when the problem's been there a while. And I think over the last 10 years, I got very interested in proactive healthcare, preventative healthcare, seeing what we can do to prevent these problems being there in the first place. I think also pulling from those early experiences doing lab grade science and research on metabolism and endocrinology, and seeing some of those things, and seeing essentially where medicine is moving, it got me more and more interested in kind of just generally trying to support people who are trying to improve their health. And I think I was involved in quite a few different startups and companies over the last sort of 5, 6 years, all manner of kind of digital clinics and online tools. And eventually that kind of led me to exploring what are the real key things that we can focus on. There's a huge longevity movement at the moment. And I think that longevity is an umbrella term, and it means different things to different people. But what I kept coming back to is actually men's health. And I think that was because a lot of the time I would often see men presenting in an A&E when they had something for many years, but they had maybe been too embarrassed to seek help, or they'd been too busy, or they'd just been brushing it off, as we know that men typically tend to. And that can manifest in many different ways, but it can also be quite heartbreaking, because it can lead to the time where someone comes in with essentially with a heart attack or on death's door because of simple things that could have been picked up much quicker, much earlier. And I've started to see a bit of interest in men to try and be a bit more proactive with their health. I think COVID was an opener for that. But so I was assisting the original founders of TED's Health with regulatory licenses. And that's something I used to assist a lot of different companies with. I helped a menopause company with that about 4 years ago. So it's a natural segue to help a men's health company with a CQC license. And then after lots and lots of conversations and finishing off various other projects, I dived in headfirst into TED's Health last year as medical director. And it's really been a thrilling journey so far. It's been really great to actually be able to deliver the kind of service that we do. It's constantly eye-opening, because speaking with patients who, again, are often quite surprised that actually there is now a potential explanation for the symptoms they've been having for many years. And then potentially, if appropriate, being able to provide a solution, namely TRT, is really rewarding work. And I say that having done lots of rewarding things in A&Es and intensive cares, and in some cases assisting with life-saving stuff. But actually there is something almost greater in being able to deliver a service which we can do digitally, which means we're more accessible across the country. And that is really what I'm passionate about, and really what I'm enjoying doing and hope to continue doing for a long time.
Amazing. On behalf of men, thank you for having that passion for men's health, because like you quite rightly said, and you see firsthand and you have done for many years, is we have traditionally left things for far too long, whether it's physical or mental health. Kieran and I have both talked many a time about when we were going through our fertility challenges, how we left stuff, like certainly mentally and emotionally, for far too long until it got to that break point. And there's been a great shift on mental health, but now, like you've alluded to, that has shifted to other areas for men, and that kind of the internal workings, and testosterone being one of those. The conversation is really growing in that area. And I've heard it referred to as, for men, testosterone being the tide that lifts all ships in the harbour. So what exactly is testosterone? How is it made, and how important is it for men?
As alluded to earlier, testosterone is a hormone. It's a sex hormone. So it's an androgen. It is the primary male sex hormone. What that means is it is responsible for the development and the maintenance of all male characteristics, physical and sexual as well. Everything from essentially the development of becoming a man through puberty. So from boy to man, which, if you follow that natural cascade, physically is muscle mass and also muscle maintenance, increased bone density, general kind of from a sexual perspective. That's obviously the maturation through puberty of being able to become fertile, but also libido, so interest in sex, that drive. And then mentally, cognitively, if you like, it's responsible for many things. And I think different people will probably attribute different things, but everything from your drive and your motivation, which might be there more in a cognitive perspective, i.e. being able to focus at work, for example, concentrate on tasks, but also more into the more emotional aspects of mental health, namely your mood regulation. And if you think about testosterone being responsible for, like I say, the development of that from boy to man, but also the maintenance of those throughout life for men, but also any potential deficiency. So if it is lower, then obviously one is not going to be functioning as optimally as they could. So it could be the explanation for any number of things in those respective characteristics. For example, loss of muscle mass or inability to maintain muscle mass could be attributed to lower levels of testosterone. Increased risk of fractures or osteoporosis, weaker bones. Typically, we do associate that with aging and being older. Older people who tend to sometimes fall might have a hip fracture. That's very common. We know that the evidence shows it's more common in women, but it's not impossible. And it does happen, obviously, with men as well, of all ages, but typically as they get older. Testosterone does have a factor or play a factor there. It is a component to the promotion of healthy bone density. Like I say, if you think about what it can promote, that is the optimal state, and any deficiency would be responsible for a potential medical, possibly even diagnosis there. So even coming to mental health, very commonly low mood. And I'll say low mood versus depression. We could also look at depression as well and other aspects of mental health. But even one's low mood, which would typically be diagnosed as depression, could be the result of low testosterone levels. And this is a very key one, because actually I think many men, when they are experiencing low mood, and I think we have to be careful here with exactly putting a box on things, because I think everyone experiences down days and, but I think there's a very clear distinction. But a man who may be experiencing lower mood more often than not and actually want to seek help, and everyone's got different stories, whether that's going for therapy or speaking to someone, or whether that's a medical professional. Countless stories that I've heard where essentially a man gets put on antidepressants. And antidepressants are often very effective medications when they are prescribed appropriately and in the right instance. They can be life-changing, they can be game-changing. But we also do know that they don't necessarily work for everyone. And that can also be because it might not actually be fixing the root cause of the problem. Namely, if there is an instance where someone has low testosterone levels, which could be contributing to a number of things, including low mood, then simply having antidepressants may not necessarily really improve that person's mood. So I think it's very important to look at the potential array of different aspects that testosterone is related for, from the physical, from the sexual, from the mental and emotional, and also try and maybe ask the question, could this be related to the hormone testosterone? And then finally, I should also mention that testosterone is also present in women as well. Yes, it is primarily, like I said, it's an androgen, so it's the primary male sexual hormone, but it is also present in women. Women tend to produce that a little bit in their ovaries and also from the adrenal gland, whereas men, it's predominantly from the testes, from the testicles. A particular cell, there's actually the Leydig cell that is responsible for that. Hence, testicles obviously involved with spermatogenesis, so the production of your sperm, which is obviously responsible from a fertility perspective. And for women, testosterone does play a part in some of the sexual effects as well. So libido, interest in sex as well, and also muscle mass and bone density, but to a lesser degree. So it is not as significant for women. However, and this is quite topical at the moment, it is being utilized as a therapy alongside HRT for women, for perimenopausal and postmenopausal women, for treating low libido. So it is interesting to highlight that, yes, I know we're here talking about men, and that's commonly our practice at TED's Health is focused obviously on men and men's health, but testosterone does have a role in women. And as a treatment, TRT is also a treatment option as well.
This podcast is sponsored by NeXYs Health. NeXYs understand how vital it is to stay ahead of the game with your fertility. Their at-home sperm tests show exactly where you're starting from. No NHS queues, no pricey clinics, no stress. You don't even have to send the sample through the post. By harnessing your phone's camera with the NeXYs device, you can record a video of your semen for the app to analyze in minutes. Doctors are just a message or free video call away with personalized tips to boost your motor count. Get 15% off today by visiting exceedhealth.com with discount code MFP15. That's MFP15.
Thanks for that, Johnny. It's a very complex hormone, isn't it? It really does so much in the body. And I think, certainly from my perspective, until I was in the fertility world or in a space, we say it, I didn't really give much thought to it as a man. I just assumed it was all going to be all right. There is a narrative around it at the moment in society of we've got to be aware as we get older. How does age, a guy in my situation, 39, heading towards 40, how will age affect my testosterone levels? And should I be looking out for those symptoms or the signs like you've just explained?
I think that's a really great question and definitely worth speaking about. So we often are very familiar with women's hormones and what happens with age, namely menopause. And that's because I think the public awareness of that is much more widespread than HRT. But actually, I think sadly, your question here highlights that there is still a lack of awareness and understanding of testosterone, especially when it comes to men. And that's one of the things that I and we at TED Health are really passionate about doing, is just the education piece. So yes, to answer the question, testosterone levels and all hormone levels tend to fluctuate with age. And so yes, as age increases, typically many, I don't want to generalize, but hormone levels will tend to decline. Testosterone is one of those for men, yes. So typically testosterone levels will rise and steadily rise exponentially during your teens. So puberty, it's like I say, it's directly responsible at that moment to the development of all those different characteristics. And like I say, typically in puberty, what do you notice? You notice anabolism, increased muscle mass, growth, lengthening and strengthening of bones, deepening of the voice, in some cases with excess acne as well. That's quite typical. A range of fluctuating, if you like, hormonally driven reactions, which again is very common with teenage boys, right? So that leads to, yes, a lot of energy, but also can lead to just in that state where everything's going a little bit wild. Boys will be chasing girls, fighting, and that is in some part probably related to testosterone. Typically in the 20s, the levels will stay high. But what tends to happen is from the mid-30s to the 40s. And again, this is highly, I wouldn't say disputed, but it's hard to put an exact age on it for everyone. It is quite unique to the individual. And there are, like all things, numerous factors involved, such as genetics, lifestyle factors, environment, etc. And we can talk about those in a second because that is relevant to other aspects. But typically from the mid-30s to the 40s, the research shows that testosterone levels tend to decline around 1%, in some cases 2% per year of life. Meaning from your 35 to 40, you might have dropped 5%, but another man might have dropped 10% in that time. And that does continue. So it is a gradual decline, if you like, over those prospective years versus something like menopause, which typically is a bit more, to use your words, falling off a cliff. And menopause is, and again, obviously individual variation, but typically mid-40s to early 50s, quite a fluctuation, but essentially there is a massive drop off and obviously the symptoms to follow with that. But age-related male testosterone decline is quite gradual, as the data suggests, right? 1% a year. So it could be almost so subtle that you don't realize it until you do realize it. And of course, we're talking about an average, but actually, maybe you have a different experience of this. And I'm 36, pushing 37, but thankfully haven't quite experienced that yet. Might go on to not experience that for, who knows, another 5 years, 10 years. It's completely, like I say, individualized. So age is a very important factor. But what I do like to counter that is one shouldn't also just assume, right, I'm too young for my testosterone to be low. I'm only 32 or 33. And actually, we do find not many, but we do find that there are younger men who are increasingly younger men who have low levels of testosterone, who are biochemically hypogonad, which is the sort of scientific term for low testosterone or testosterone deficiency. And again, there can be different causes, and we can touch on that in a second. There can be anatomical causes from disruption of the HBG axis, if you like, and there can be all the other lifestyle-induced factors, so obesity and other factors and other medical conditions. And it could be, if you like, environmental as well. So diet, lifestyle, meaning sleep, exercise, stress, alcohol, drugs, etc., affected. So I think one of the things that I say, I'm trying to paint as wide a picture as I can here. But in reality, I think my sort of take home is, as a man, if any of that does resonate and maybe make you think twice and say, oh, actually I am X years old, and whether that is lower or even way higher than what the average start for the decline is, don't hesitate to maybe reach out and see if you can check your levels, whoever that is with, because I think it's always good to at least establish a baseline and you can see where you go from there.
Yeah, I was just going through life, and when a problem arose, i.e. in my wife and I's situation, it was our fertility, and then going through all the initial tests, it was established that, so I was 34 at the time, and my testosterone was 12 nanomoles per litre, which on the reference range is the lower end of normal. I think is it 7.9 to 31 is roughly the range in the UK.
We'll talk about that in a second, but yes, so it's on the lower end if we're talking total testosterone here, but
Yeah.
Definitely on the lower end.
Yeah, exactly. For a 34-year-old as well. And I wasn't hands up, I wasn't like a health nut or anything, but I wasn't unhealthy. I was just typical kind of, I could go out and run a 5K if I wanted to, but I was also drinking far too much on the weekends in the pub as well. But then for me, it was that kind of that cliff drop for me, because so my infertility came through primary hypogonadism as a result of mumps orchitis when I was 22. And that testicular damage is quite likely as to why it was low at that age. And then as part of my fertility treatment, I had a microtesia where my testicles were cut open. And one side effect of that can be it affects testosterone. And mine was very much that cliff drop afterwards. And like you were saying earlier, like I guess for some people, when it is that slow creep, that 1 or 2% decrease over time, those symptoms can probably come on very slowly. Mine it was strange because only when in hindsight, when I became more educated about it, I could tick them off more. But the really prevalent ones were brain fog around about lunchtime every day. And it was always roughly around when I go to the gym at work as well. And I remember sometimes going down and getting on the treadmill just to warm up. And I felt so dizzy, I thought I was going to faint. I didn't know what was going on. And I remember one day, I lived and worked in London at the time. I was getting the tube to work. It wasn't that hot. As we know, the tube can be excruciating on summer days. But it was the late autumn, I think. And I was beading with sweat. And I'm not a particularly sweaty person. And I was thinking, what is going on? And then I remember saying to my wife about it. And then we were lying down on the sofa in the evening, not moving. And it started happening again. And it was that. Then, yes, over time, I started noticing other things like loss of libido, like not waking up with morning wood, things like that. And then, as you said, that sustained period of low mood, not being able to concentrate. And yeah, it's when I called my doctor and said, I think I actually called the fertility clinic and said, I feel like this doesn't feel great. And so they got me and tested, and I think I was at 5 nanomoles per litre at the time. And they talked to me about TRT. Obviously, I'd have to go through my GP. I didn't want to go on it because I was aware that it would be a lifelong commitment. So I did everything. I did lots of research. I lived a completely testosterone-friendly lifestyle for a long time, changed my exercise routine. I ate a low glycemic diet. I kicked booze completely. Did that for the best part of, I think, 6 to 8 months. And much to my annoyance, my levels went down. Got them checked again. They were down at 3. I was like, are you joking? Right, come on, hit the button. Give me some TRT. Yeah, quite a journey.
Yeah, and I think that probably will resonate with people because sometimes, frustratingly, actually, a lot of the things that medical professionals generally will say, do more exercise, eat healthier. Okay, people do try their best, genuinely, and you can take that a level deeper and actually apply that more specifically to, as you say, like testosterone-friendly lifestyles. You can do all of that good stuff. But in some cases, And we can explain a couple of the reasons behind why that can be the case. It doesn't work. In fact, if anything, it works out the opposite way. One example is weight loss. Now, we mentioned about anabolism. So testosterone is responsible for kind of muscle growth and development and maintenance. But with that also comes maintaining lean mass, meaning it's easier to burn fat, adipose tissue. So it's in what most men are aspiring to, typically, it is looking to put on a bit more muscle if they can, beef up a bit, and trim the fat if they can. And I think typically, as one enters kind of midlife, that's where we see the excesses of maybe your teens, but more your 20s, partying, booze, whatever, just being able to eat rubbish when you're young, go out. When you're young, you can party and you can stay up late and get up the next day and go out and booze again and eat rubbish. And it doesn't tend to, for many people, affect their body so much. But there comes a point, typically around the 30s, but definitely hangovers are a real thing. And you really notice that, yes, you may crave bad food, junk food, but you will notice the effects. And I think we're speaking about holidays, and yes, I am on one at the moment, but it's noticeable, right? I've only been here a week and a lot of French food. So obviously cheese and some processed meats and things. And I'm actually thinking, those shirts a bit tighter to put on, and it's only one weekend, but that's the way we live. And you may have to question what's happening to testosterone levels now versus, say, 30, 40 years ago. And is there a bit of a decline? The answer is research suggests there is, and there are lots of reasons for it. And these things are never one answer. There's usually lots of things. But one of the purported things is obviously the way our typical Western lifestyles are. They're not necessarily the healthiest. And if you continue those unhealthy habits into your midlife, you're paying for it. And again, weight is a key thing. So typically people say, hey, I want to lose weight. And when you do often lose weight, which is one of the things that you should do to try and improve your testosterone levels, actually, you almost have to drop about 20% of your weight. So about 20% weight loss to actually get to the point where you haven't just ended up mopping up that free testosterone. Because actually a little subtle bit of weight loss, which might be impressive and definitely a good thing for other aspects of your health, especially if one is obese or overweight, can actually lead to a functional decline. Now, I don't know if that's the reason in your case, Shaun, going from 5 to 3, but it'd be interesting whether that might have played a factor in it. Certainly will do for many men who are trying lots of things, kicking the booze, eating healthier, losing some weight, going into the gym. But actually they're noticing, hang on a second, my level is a bit lower now. I always like to look a bit more holistic, and I'm a big advocate for also looking not just at siloed points, getting so obsessed with one number, but actually looking at the big picture. If one can do more frequent testing, that is better. Now, I know not everyone loves having blood tests, myself included, so I do understand. But following the guidelines that we do at TEDS Health, which are the British Society of Sexual Medicine, to even begin one's journey with TRT and get diagnosed with true testosterone deficiency, from a biochemical perspective, you need 2 blood tests, ideally at least 4 to 6 weeks apart. You can't just do 1 blood test. What are the reasons for that? That's because, remember, these hormones do fluctuate and they operate on a diurnal pattern, meaning in response to your circadian rhythm, meaning the time of day. So typically testosterone levels are highest in the early morning, and therefore the blood test should ideally be an early morning sample. That's even more true the younger a man is. As men age, that probably is less of a factor, the diurnal variation. But typically with younger men, we see levels are very high in the early morning, and then they do decline a little bit in the later day and into the evening. But other factors are illness. So one has, or stress. Now, why is that? Now, stress can mean different things to different people, but essentially with an acute rise of the stress hormone cortisol, which can be from personal stresses, it could be from work stresses, it could be from any number of things. But typically that is going to put a strain, and testosterone levels are going to be affected by that negatively. Cortisol levels are higher, testosterone levels are lower. If you can reduce stress, you should hopefully improve and optimize testosterone levels. So if you are doing a blood test, which is low, and you are at a particularly stressed period of your life or time, it's important to factor that in. So doing another test some weeks later, and that's why we say 4 to 6 weeks later, not 2 days later, that might mean you're out of that stressful period, might not as well. But infection, which I mentioned, so viral illnesses, so things like flus, but also COVID. And during COVID-19, we did see quite a bit of interesting research crop up in this area where testosterone levels were found to be much lower even 4 weeks after a COVID infection. So someone tested positive, they were ill, they had the typical symptoms, cough, loss of smell, feeling rubbish, fatigue. Maybe they had tested negative and they'd passed that main bit of the COVID illness, but actually their testosterone levels did take, in some cases, 4 and 5, 6 weeks till they got back to that baseline. But those are some of the reasons behind why at least 2 readings for the diagnosis is important. And just bringing it more broadly, and even to what you were saying, Shaun, I think that's why we shouldn't just dig in and get so obsessed about 1 or 2 particular readings. Ideally, we build up more data and we can be a bit more objective and really dial in and say, actually, you did decrease and you were living a testosterone-friendly lifestyle, but maybe there were other things when you tested and you were 3. Maybe you had actually recently had an illness or suffering with poor sleep or other things which might have accounted for that.
Yeah, sure. There were more, but yeah, it was frustratingly that the levels never really, they went up very briefly and then back down. So I think what I remember saying to the endocrinologist is clearly even a dead cat bounces. So it's time. But yeah, no, thank you for that. It's really, really interesting. And like we've all said and alluded to, the conversation around testosterone in men has increased. There is a concern for is that perhaps then people are seeking it through less reputable channels, let's say, on a best case scenario. So what are the risks with that when people are getting testosterone in whatever form from, let's say, their mate at the gym?
So as mentioned, so I've used the word a couple of times, anabolism, which is promotion of muscle or muscle growth. So many people are familiar with anabolic steroids. So testosterone is a steroid. It is formed from cholesterol, and that's natural testosterone, which is, like I say, the hormone that's produced from the testes and is biochemically available in the blood. But obviously you can have other types of testosterone, which are synthetic, meaning it's man-made. And there are different types. These are esters, chemically, they're produced. So they are chemically similar, but they might have different bits on the chemical structure. So there's testosterone undecanoate, known as libido, which is a kind of long-acting injection.
That's the one I have.
Okay. How are you finding that?
Yeah, it's good. I was on the gels for about 3 years and had varying results. I started on, it's difficult to remember now, so long ago.
Oh.
It's Testogel. It was either, no, it's Tostran I started on, which I got on really well with. I found it really easy to, once we hit the right dose, the levels remain quite steady. Obviously, it's a daily application, but then I couldn't get it. And there was a bit of a shortage. And I think that one is one that they also prescribe to females as well, isn't it? Because it's a lower dose. So then, because I couldn't get that one, I went on to Tostran, and I just didn't get on well with it at all. My levels were all over the place constantly, even though it's a stronger gel. But yeah, we just couldn't regulate it. So I went to the injection. And actually, it's been literally, apart from quite literally a pain in the ass every 12 weeks, it's fine. And overall, I took the approach that, yes, the gels were a bit inconvenient, but I thought, if someone isn't willing to do something that's a bit inconvenient every day for their own health, then how seriously are they really taking their own health? But it was more just because I couldn't get the one that worked for me. The next version didn't at all. But yeah, I found that libido really good actually. And only once towards the end of the 12-week period, because it took a bit of, if I recall, it's going back a couple of years now, but it started out, I think 8 week, then something like that. Yeah.
The time load and to get the levels to optimize can typically take 5 injections or so. So even perhaps.
But only once during that have I felt the effects of low testosterone at one point. And I was able to call the GPs and say, look, I know the feeling. It's like, can I move my injection forward a week? And they said, absolutely fine. Because your health is your own responsibility. And I know what those feelings are like. And they were really understanding about it, thankfully.
Well, that's good. It's good that you've found healthcare professionals that firstly listen to you, but also feel comfortable and confident to make those kind of decisions, which actually with many doctors, and that's one of the reasons even coming back to the original question and what led me here is I felt I knew a little bit about it from medical school, but actually wasn't something that was widely taught. Typically, it's something that specialists will do, endocrinologists, but they're few and far between. Most GPs don't really know much about it. In contrast to HRT, which actually, as we know, it's far more commonplace and accepted and therefore available. And so it's only kind of niche clinics, very expensive Harley Street type clinic doctors. And yes, it's more available in places like North America, which typically obviously does lead the way in lots of things. But I was very passionate on challenging something that was highly stigmatized, even amongst the medical community as well as publicly, for the reasons we mentioned, anabolic steroids. So coming back to that again, it's sad that there is all this stigma. And I think we're starting to see that a lot in healthcare, actually, that lots of traditionally controversial things are now being challenged, namely like psychedelics in some use cases in mental health, for example, use of medical cannabinoids, et cetera, it can go on and on. But with anabolic steroids, or if you like, non-medically sourced testosterone replacement, there are potential risks that could happen. And I think I don't want to sound like no, you shouldn't do that, because that's what my profession and that's what you'd expect a doctor to say. But if one is doing something and there's no monitoring involved, how can you really know what's happening? And I don't mean that just only from a negative, like how do you know that certain safety levels are not going too high? How do you know that you're actually improving or you're not improving? And when you do it in a structured manner through a reputable clinic or provider, healthcare provider, who has some experience in that field, then, and obviously you have to find someone that you trust, and there is an openness. And again, we as a clinic and I as a doctor generally take that approach that I trust my patients, and whether you come to me and tell me lots of things that you're doing and whether those things are illegal or not, I'm not here to judge, because again, my understanding of being a doctor is to be there to help people, and help is no guarantee as well. I can in some cases do things that might be life-saving, but we can't promise to save people's lives. We can't promise to cure people. All I can do is do my best, give my opinion, and try and make sure that opinion has some grounding on that. Namely, it's evidence-based medicine. So that's the typical practice that you see here in the West, right? It's evidence-based medicine. There is research, there's clinical trials. And I know that sometimes some of these words scare people. Some people are very skeptical of going to doctors or going to traditional healthcare settings. And again, there's stigma on that front. The pharmaceutical industry trying to make money, trying to profit. We don't trust that. We want something that is natural. Or we'd rather get it from someone who's not profiting from it. We'd rather get someone who's making it themselves locally rather than getting it from big pharma. But actually, I would argue that it's not a case of just shop local. It doesn't work like that, because actually someone who might be manufacturing it illicitly probably doesn't have the general health of that person's and well-being's interests at heart, because they probably also are driven by profit. And yes, in the short term, one might see some improvements. But even I've seen cases with the bioidentical hormone replacements and more natural type therapies. And there are quite a few of these online. And I'm sure you've probably come across your many types of supplements purporting lots of things, right? Improvement in fertility, improvement in libido, improvement in whatever, right? Because the supplement market is less regulated versus medications. But the danger there, and I've seen some of these patients often do come to us having tried lots of things from the black market, so to speak, and from elsewhere, and even in other countries. And they come to us and they say, yes, but actually what happened is I felt great for a bit, but then my levels went swinging and high. And when you have too much testosterone, that can get converted into estrogen because the excess is metabolized, and that can lead to camastia, which is essentially development of breast tissue. So essentially man boobs, which is obviously not particularly nice. And that can also this kind of yo-yoing of hormone levels, if it's not done in a structured way through a proven protocol, which is how we go about things, that can lead to too much of a roller coaster effect. So yes, I'm feeling good some of the time, but actually there's these massive dips, and then I'm asking what to do and they're just saying, take more of it. And that can lead to all those nasty side effects. And I think side effects are important to mention. There's a lot of horror stories, and I think a lot of people will probably be somewhat skeptical and nervous to even consider something like TRT because they say, I don't want that, or it's going to cause cancer, or it's this or that. But I think my short answer to that and take home here would be to say that medically prescribed TRT, which is what I do, what we do as a licensed clinic, is not trying to supercharge levels. It's just trying to get someone's levels who have been found to be below what guidelines say. And this is done on tons of research. And so what is lower than what you should be for your age as an average man, back to what should be normal, what the baseline is. We're not trying to supercharge things, just trying to get levels optimized back to normal.
Yeah, you've hit so many good points. It's a murky conversation, isn't it, about testosterone at the moment? Going back to like steroids and things like that, like I'm working as a PT, there's a culture of it. Like it's a real big issue. And it's not just a youngster thing either. It's like men of all ages. And I'm going to say men because predominantly they are men. Are you seeing, in terms of people coming and getting the testosterone tested, are the younger generation taking note of it more? Or is it like people our age that through their own kind of education have gone, right, something's not quite right? Or is it changing? Is that kind of conversation changing?
We want to tell you about Impril, the unique supplement for conception, which is recommended by fertility specialists for both men and women. We know that poor nutrition is one of the leading causes of infertility, but we are also aware that it's practically impossible to maintain a diet that's perfectly balanced, especially for conception. Choosing the right supplement can be confusing. Many multivitamins contain strong antioxidants, which may actually damage sperm quality. Impril is made from activated micronutrients, which help every cell within the human body, from the biggest, the egg, to the smallest, the sperm. These micronutrients have been clinically proven to significantly improve live birth rates for men and women who have previously been struggling to get pregnant. You can find out more and hear from couples who have used Impril by visiting fertilityfamily.co.uk. If you decide this is for you, there's a 10% discount just for our listeners. So make a note of the code MFPodcasts10. That's capital M, capital F, podcast, all in lowercase, 10.
Yeah, that's a really good question. And each time you ask a question, I keep saying, I should have said more on the last one. I think just to touch on maybe the elephant in the room that with steroids, and typically what the biggest risk is for young people. Now, whether that is taking it illegally, which is obviously much easier in many ways because you're not necessarily having to be proven to be low and do all the tests, whereas actually to get prescribed it, you're only going to get prescribed it with a prescriber who feels comfortable that you actually meet those guidelines and you truly need something. Do I prescribe a lot of TRT? Yes, but only where it's medically appropriate and I feel it's safe and in the best interest and there's consent and all the rest of things. But if there's an 18-year-old is saying, hey, I just want to improve my levels, but I don't want to do the test, and will you give me some? That's not what I practice. If someone is getting steroids elsewhere and they don't actually need it, one of the biggest risks is to fertility. Why is that? So we spoke about hormones. They are endogenous, the hormones that are natural in your body. Anything that is outside of the body, like synthetics, so whether that is the actual manufactured medication, TRT, or whether that is illegally manufactured anabolic steroids, doesn't matter. They're all synthetic. And doesn't matter what people claim that it's more natural, it's got plant this or that. It doesn't really matter. They're synthetic at the end of the day. And why would you trust a farmer-produced one? Is because it's standardized, it's sterile, all the ingredients have been tested. And yes, sometimes years down the line, people find out that things maybe weren't the best and these get refined and get improved. But the TRTs that have been licensed and available and the ones that we use have been around for decades and they have been proven to be very safe and effective with some side effects, but ones that a healthcare professional can mitigate against. But coming back to the question about fertility, exogenous hormones, so TRT, anabolic steroids, is going to render someone infertile. Why is that? Because essentially it works on signaling, feedback. Now, typically, if levels are found to be low, what happens is it's almost like there's not enough production from the testes. That's the signal that's going back up to the hypothalamus and the pituitary that in the brain, which is orchestrating all other hormones as well. And it's saying we need to increase things. So it says send more GnRH and then LH. And LH is responsible for your testosterone production. FSH is more for spermatogenesis, so the fertility. But if you're getting exogenous testosterone levels are looking like they're high. So it's actually saying switch that off, decrease it. The levels are good or high now. And that actually means that over time, you're actually getting less for the FSH and you're getting less spermatogenesis. So you're getting less sperm produced, meaning fertility drops. And that is true while a man is on TRT. And in theory, once someone comes off TRT, that should reset, but it's not instant. And it's not necessarily even guaranteed. It can take, in some cases, weeks and months. And like I say, it's not always guaranteed. Why? Maybe years have passed and actually one is now no longer going to be fertile again. But it is an important thing to say. And that's something we spend a lot of time as doctors and providers counseling patients and talking to them and checking before prescribing. Where are you at in life when it comes to fertility? And to answer part of your question on the younger man's concern, typically, we spoke about it. When you're young, you want to enjoy life. Typically, many people do anyway. You're partying, you're doing all the bad things to your body because you can get away with it. There's that degree of tolerance. You don't know, arguably, you don't know what you don't know. You know, as a 20-something, how many 20-year-olds are thinking of kids then when they're partying and enjoying life? Probably not many right then. Say, oh, yeah, kids down the line. But actually, I don't care what I do or take, or I just want to enjoy, have a bit of fun now for my 20s and we'll worry about that down the line. But say you're into working out in the gym and you meet someone who's going to give you some gear and you say, actually, yeah, I want to beef up. And the downside there is potentially affecting your fertility. You're making yourself infertile then. And who knows what that's going to do in the long term, if and when you do come off things. So yeah, that's maybe put the first part to say, and a real big take-home message, I think, when people are thinking, yeah, do I go somewhere else that's cheaper or this or that, or get something online or whatever, dark web, who knows where people look to source things. But I know that people do try, right? When people want something, they just want it instantly. They don't want hoops to jump through. But yeah, I can't really stress the importance of doing things properly where you can, and really considering those risks. And I know as a younger person, like everyone wants shortcuts, don't they? Let's be honest. If you can get a shortcut, who doesn't want a shortcut? But really think about what those risks are. And really, that's what I'm trying to do in a very non-judgmental way. Just put the information out there. Because yeah, what I'm most passionate about is that people who are looking after the interests of their own health are doing things with the right information, not misinformation, not getting influenced by influencers who might have different agendas, what they hear around the echo chamber they're in, but really being able to weigh things up. And if after hearing everything, they've made a conscious decision to go down a route, that's not my place to judge, ultimately. I know other people are very different about that, but I'm genuinely that open about it. But I just want to make sure that everyone has that same baseline of kind of, there are pros, but there are also cons.
There's no coincidence as to why we've asked yourself and as by extension, Ted's Health to come on here, because we know that you have that mindset of, like you said, you use the word counsel when you're speaking to guys, and you're not just looking at another sale for the P&L sheet or whatever. It's people's life, and that's why we really value your time this evening. And when it comes to that conversation, so say you've got someone coming to you who potentially is would be a case for someone who could well have TRT, but also would like a family and hasn't quite got to that point yet. Where does that conversation go? What other options are there possibly open for them at that time?
Great question. I think I am just generally trying to become even more holistic in my approach. And when I say even more, I mean, in medical school, we always talk about lifestyle, but that's not typically med schools of the decades gone by. It was just a quick tick box. And I think most people will recognize that because they say, I'll go to see my GP. They do a couple of blood pressures and they want to put me on pills. And that has evolved, and people say, now cut down your salt, look at your diet, look at your sleep, look at these things. But still, most doctors aren't too drilled down into what actually can be done from a lifestyle and holistic perspective. I'm constantly trying to learn more and read more about food and supplements and minerals and everything in our environment. So to answer the question, medication is not the only answer and should only be the answer when everything else has failed. And with all the other things that you do alongside that. Echo something you said, Shaun. It's like, once you've really tried everything, then fine, you were like, you found that time when you were ready for it. But like you say, If someone's not willing to make that change or do something daily or commit to something, then do they really want it? How much are they really that incentivized if I don't know, I can't do that, or I can't eat better, or whatever that might be. So yeah, absolutely, lifestyle it cannot be ruled out of the equation. And we spend a fair amount of our time on our consults when we do them, even when they may not lead anywhere. So even when I see the levels and the levels are not deficient, meaning I'm not going to be able to prescribe TRT now and maybe never, that's fine, because I want someone to leave genuinely feeling empowered, not just saying, yeah, the doctor spoke about stuff and said, yep, you can hit TRT once you get your level less than 12 or whatever, 14 if you're pre-diabetic. I want someone to actually leave with kind of almost a bit more of a personalized action plan. And that's why I say counsel, and it's a discussion and I ask questions. And I think the real art of being a doctor, and what I do love about it, even in the tech world that we live in, that I do love, is this back and forth and being able to really get to understand someone. Even if we spend 30 minutes with someone, you can really actually get to understand a bit more and see a picture of someone. Typically, I see some men who are taking the calls in their van, and you can tell they've been up from 5 a.m. and they've been hitting and you can tell they probably live quite a stressed lifestyle. Their cortisol levels pretty high. And actually, you only need to then feed off that and ask questions, and they go, actually, yeah, it could be a bit better here and could be that. And I think another thing is, that's why I talk about that trust and relationship. But if you do find a provider that you feel is listening to you and trusts you, whether that is the NHS, great. If you can find that, excellent. Whether it's a private provider, whoever that may be, it's important that dialogue goes along. So you ask questions as well as a patient, but also make sure that it is personalized. So being transparent as well. So actually saying, yeah, actually I drink every night. Okay, fine. Then we know what we can work with. But yes, lifestyle. So that is food, that is sleep, that is stress, that is alcohol, that may be drugs, that may be other medication, that may be other medical problems. But also even digging into a little bit more of the history of that person. If you've had a lot of head injuries or concussions, a lot of sports players have, maybe you're into MMA or boxing. Okay, so you've been taking a lot of head injuries. That can really disrupt that first part of the hormone orchestration piece of the HPG axis, hypothalamus and pituitary. Maybe it's been down at the testicular level, right? Maybe it's been something like mumps orchitis or a surgery. Maybe it might be environmental things. And now this is a big separate topic, I'm sure, but just touching on it, we do know that there's lots of things in our environment that has changed now in the 2000s versus 100 years ago. One is with our water supply. So since the oral contraceptive pill was available, and other things that are entering our water system, from chemicals to pharmaceutical grade medicines, that is potentially having some impact. Plastics and microplastics. And yes, that is quite topical. And I think people's understanding of that is varied, and something I'm still myself trying to learn more about. But toxins, waste, even things we wear, creams we might use, whether that's beauty products, all of these things potentially have some impact. And we don't know, again, what might be true for me might not be for you, and vice versa. So hopefully I'm trying to highlight that actually there's so much that even a doctor who's speaking to someone isn't going to be able to dig into all those specifics. But it's important that someone comes away with this and says, there are so many factors at play here, but what are the things that I can do? And it might be just those basics. It's just eating better. It's regulating your sleep. It's trying to minimize your stress. It's trying to exercise and do the right type of exercise. So resistance exercise, typically the ones that use more muscles. Okay, we're getting nods from the PT. That's always a good sign. But again, why that? And that's typically the more muscles you use and engage, you're more likely to see a more noticeable impact on testosterone. So yeah, there's so much in there, and we could unpick that more. And typically that's what we do on a consult. We tailor it to the individual based on their lifestyle and their circumstances.
Yeah, those heavy compound lifts, they are key if you're going to be in the gym and you're trying to improve your testosterone post-exercise, because the research is still out in terms of how long that affects you for. In terms of usually it comes back down, but regularly interacting in heavy weightlifting will have a positive impact on your testosterone development. I think one thing that we can really take away from this discussion is there is a real lack of education, especially for these young guys that are out there, because I'm sure Shaun will echo this. No, we didn't cover any of this when I was at school. I remember sitting learning about the menopause, but not about my own hormone, testosterone. It was probably something that you related to. You've mentioned it earlier about those teenage years, being slightly moody, slightly aroused in situations I shouldn't be aroused in, but that's a normal part of development. But you have to find that out yourself. You're not educated on it, and you're not educated on how that's going to impact you as you get older. And there's so many of those signs that you've talked about today. I feel it's a topic that needs so much more work and so much more correct education, correct promotion, just like you guys are doing at TED Health. It's been incredible having you on, Johnny. Really enjoyed it. And I feel we could just sit here and bounce this back for another hour easily.
I feel like this definitely needs part 2.
Yeah, I do as well.
I genuinely want to echo that. I take the approach that I'm still learning as well. Yes, I feel comfortable and confident in prescribing. And yes, I have developed expertise here, but I'm still a lifelong learner. And that's not just as in the world of testosterone. That's as a doctor and as a person, as a human. And that's way more than just the prescribing. That's understanding, as you say, like society and like the development of kids and going through schools and all those things. And I think we haven't as a society got things right. There's a whole different debate on kind of masculinity and what that means now versus 50 years ago.
Yeah.
And a whole host of other problems there, not all related to testosterone, of course. But it really begs the question, like, how can we be more positive about it? And how can we have the healthier conversations about things like testosterone and TRT? And if TRT is really that taboo, then, and we're just not talking about it, then actually we're just brushing things under the carpet in the interest of not trying to say anything because it might offend people, when really there's nothing, it's not a topic that should be offensive. Actually, having understanding and awareness, again, is actually how we learn about where we fit in the world and in society. Yeah, I think there's still so much there to be done.
I think it holds the same, like testosterone on its own holds the same stigma as male fertility does. As we've talked about, it's about raising the bar, the standard of that communication and that education and being open about it in society. Because research says this is on the decline. We need to know about it. So many other things. And just to ignore it would be ignorant on our own as a society. But no, it's been amazing having you on, buddy. We always finish with a similar question. And the question is, if you could offer one piece of advice to a guy who maybe is concerned about his testosterone, what would your piece of advice be?
I think my one bit of advice would be for any man who is concerned about anything we've talked about, including their own testosterone levels, simply just seek a provider who is willing to test you. That might be your NHS GP. That might be someone else. That might be us at TED Health, for example. Yes, that it seems like a plug, but genuinely we are set up and developed to do this and support men who are questioning this. I am very happy if someone's levels come back normal to tell them it's normal and you don't need TRT, but this is what you can focus on. And there's still a whole host of things to do, even if you have what is deemed healthy or normal testosterone levels, by whichever standard. There's still things you want to do to potentially maybe improve things and also tackle some of those symptoms that you're experiencing. So yes, I guess my one piece of advice is, if you have any concerning symptom, if you're worried about any part of your body, whether that's erections or libido, whether that's muscle mass, whether that's weight gain, whether that's low mood, whether that's poor focus, brain fog, low energy, any of those or more, ask the question, could this be my testosterone level? And the one way to know that is to test yourself. So get a blood test and establish a baseline, and you can go from there.
Well, that's amazing advice. And I think it's perfect advice, isn't it? If you're unsure, get a test. There's no other way to know. On that point, if someone did want to contact you or TED's Health, how could they do that?
So you can visit our website, tedshealth.com. You can also connect with us on Instagram and LinkedIn. You can also find me on LinkedIn, Dr. Jonathan Andrews. Very happy to connect with anyone and everyone. So I look forward to more conversations.
Amazing. Thank you.
Thanks so much for coming on, and I'm looking forward to part 2. Thanks for listening. If you found value in today's conversation, please follow the show and share with someone who might benefit.